Hello, happy Friday. We are back again with another Friday feature. Did you guys enjoy watching our girls talk about the importance of voting and how our vote really matters and this monumental election? If you didn't watch it, I suggest you go check out our video from last week. So, this week, we are premiering a brand new social justice issue from Social Justice Summers. So, please tune in. Listen to the conversation between our Social Justice Summers participant and Miss Diane Wynn. We hope you enjoy. Have a great day. See you next week.
Thank you for your time. I'm Davin Johnson in the 8th grade. Tell me about yourself.
Hi, Davin. What a pleasure meeting you. And thank you so much for having me today. My name is Diana Wynn, and I am currently the Director of Global Programs at the Baylor College of Medicine International Pediatric AIDS Initiative. And I also hold a faculty appointment as an assistant professor at the college. So I like to describe myself as a global health enthusiast. I dedicate my work to help improve health outcomes for mostly children and families all around the world. And I have a keen interest in education as well. So a lot of my education right now focuses on postgraduates, so people who are, for example, in pharmacy school or have finished uh, school and are doing residency training or medical residence. But education is a big priority for me. And so I'm so excited to be here with both of you to talk a little bit more about COVID today.
Thank you for your time. I'm Chloe Fernandez in the 8th grade. In the 7th grade, tell me about yourself. Like, how much longer do you think we'll be in quarantine?
Mm. Hi, Chloe. It's so nice to meet you. That is such a good question. And I think that many people are asking that same question right now. I wish I had a crystal ball, but I don't. So I don't know exactly until when we will stay in quarantine. But I do know that there are certain factors that will have to come about before we can get back to some of our activities and daily activities before COVID. So one of the things that will be very important is to get a vaccine. I'm sure you guys have heard about that many smart people all around the world are working to figure out a vaccine that will help immunize the majority of the population against this virus. And so until we have a vaccine, we're going to have to continue many of the precautions and restrictions that we have. The other component of this is we'll need to have a decrease in community transmission. So what does that mean? That means we'll have to see a reduction in the spread of COVID between people within our city of Houston, within the state of Texas, within the country. And then of course, because this is a disease that doesn't know any boundaries, it's an infectious disease, really around the world as well. So there's going to be lots of things that have to happen before we see our normal lives come back.
Do you think COVID-19 is a political scam, and why?
I think a lot of people are asking that question. So I do not believe that the COVID-19 pandemic is a political scam. It is a true infectious disease pandemic that we are experiencing right now. This virus has infected millions of people and have caused insurmountable deaths so far around the world and in our country as well. So that's based on facts. And that's based on what we know about infectious diseases and science and medicine. So that's very much real. Unfortunately, politics has gotten involved, and it has complicated the community's perception of how real the situation is, whether it's made up or actually based on facts. And this, I don't think, is unique to the United States. Definitely the political rhetoric and discussion is very active around this question, and many people are politicizing the pandemic, but it's happening in many other parts of the world as well. You may have heard Germany had maybe a week and a half ago an anti-masking rally and protest, which is kind of not unsimilar to what we've seen here in the United States as well. So the pandemic is real, and unfortunately, it has become politicized.
How do you stay away from COVID-19?
Great question. This is probably one of the most important questions because we have the power to control what we do, right? And so how do we stay away from COVID or make sure that we're doing our part not to spread it? Well, there are many ways. First off is we should be following precautions and restrictions, and that includes masking. So masking is super important. And Chloe, I saw that you had a mask on before our interview. And so you are doing your part in making sure that COVID does not infect more people than it needs to. So making sure we're masking at all times when we are outside in public places, particularly when we are within 6 feet of other people who are not within our household, for example. So friends, classmates, teachers, coworkers, that's very important. Secondly, hand washing. Hand washing is so important. And this is not just for COVID, it's really for any infectious disease, but especially during COVID, we should be hand washing frequently. And we can use antibacterial as well if that's handy, but we should know that hand washing is just as good. So making sure you are scrubbing your hands between your fingers and your palms and singing happy birthday while you do it, so that you make sure you wash your hands for 60 seconds. So masking, hand washing, and then making sure that you are quarantining when you are experiencing symptoms. So some of the symptoms, some of the common symptoms that we know of include increased temperature, body temperature. When you have a fever, that's a sign that perhaps there's something going on. It could be COVID, or it could be, the flu, for example. Flu season's coming up, but it usually suggests that there's something going on in the body. If you're experiencing cough, change in taste, that's another symptom that's been identified. When you experience some of these symptoms, it's important to get tested to know whether or not you are COVID positive or negative. And then that will allow you to then make the decision as to whether you should be quarantining, which means staying at home for 14 days without exposing other people.
Is hand sanitizer effective against COVID-19? And are there certain types of sanitizers that are more effective than others?
Yes, so hand sanitizer. You guys must have remembered in March when all the hand sanitizer went out of stock because people were rushing to the stores to buy them. And so yes, hand sanitizer is equally effective as hand washing in destroying COVID-19 virus. You asked whether there are some that are more effective than others. And yes, that is the case. So the FDA, the Federal Food and Drug Administration, which is the US government body that governs all the drugs and drug-like products in our country, they actually have a list of hand sanitizers, antibacterial, that have been found ineffective or actually toxic. You can find this on Google if you Google it. And so this points to the fact that during this, this great period of need, there are many companies that have actually come out and produced ineffective, potentially toxic products as well. Sometimes we call them counterfeit products. And so it's important to know what type of hand sanitizer you're buying. You can always do your research beforehand. You can go to that list and see if the brand that you're looking for is on that list or not. And if it's not, then that means that it's a good hand sanitizer for you to buy.
I agree. How do we know a cure or vaccine is safe for the public?
Yeah. So how do we know it's going to be safe? So the good part about this is that there are some very skilled and smart people who are part of the systems that review drugs and vaccines before they even reach the public. So I mentioned the Food and Drug Administration, the FDA, already. They are the ones who are in charge of reviewing the safety profiles for all of the interventions, so the drugs or the vaccines that will reach the public. And there are very strict and rigorous procedures in place that govern how drugs are discovered or explored, discovered, and then tested, first in animal subjects, and then small groups of healthy individuals, healthy human beings. Next, slightly larger groups of human beings who may have comorbidities, which means other illnesses, and then to a larger population. So there are many, many steps, and this is part of the drug approval or the vaccine development and approval process. And so as the public, we can have confidence in what comes to our doctor's office because of the systems in place for review and approval. And actually, on that note, I hope not to confuse things, but I want to go back to one of the points that Davin asked about, is the pandemic a political scam or scandal, I think, or that you asked about. And this relates because even though we have a process in place through the FDA, there are people within our government, our politicians and some other people in the community who are doubting the process that is in place, and they are skeptical sometimes, and what this does is it throws the trust that the public has in these institutions kind of in turmoil. And so one of the parts of the politicization of the situation, I would say, is that our public has lost trust in the leaders in our country and the scientists as well, who are saying, yes, we are doing our jobs. We are going to make sure that the drugs or the vaccines that come out will be safe. But, other people are saying, well, I don't know about that. I don't know if I trust the science. I don't know if I trust you, the FDA. And so this is a really big problem, right? If we can't trust the scientists and what they're telling us, then who can we trust? And I think that's a failure on our political leaders right now.
Once the cure has been released, do you think COVID-19 will still be around, and why, if so?
So yes, once there's a vaccine that is released, and the vaccine it's not a cure per se, because once you have COVID, the vaccine is not going to get rid of the disease for you, but the vaccine, like all vaccines, will help prevent people from getting the disease in the first place. And over time, hopefully community transmission, the infection rates will go down. And so once the vaccine comes to market and to our public, COVID-19 is still going to be around for a while. And that has to do with the characteristics of the virus. And that is something the scientists are still studying. So we still don't know everything we need to know about this virus yet. And so we don't know if it's going to die out naturally in a year or 2 years, or if it's going to continue with us like the cold will. So the cold is the same type of virus as this coronavirus, this COVID-19. It's called a coronavirus. And we all get the cold multiple times a year sometimes, right? And so we don't know if COVID-19 is going to be with us kind of for the long haul. About the vaccine, we are looking forward to having a vaccine because it's going to help prevent the spread of COVID, but it's going to take time to get people immunized. So if you can imagine, there are many people in our city of Houston and our state and our country, and no less the world. And so once we even have a vaccine, the questions will be, how do we roll this vaccine out to everyone? How do we administer it? Who will get it first? What will the cost be? Those will have implications to who gets it as well.
What can people do to stop the spread in low-resource communities?
Great question. So I think your other question, Chloe, was how do I stop myself from getting COVID or help stop the spread of it? And I would say that answer applies here too. So the precautions we should be taking, which is masking all the time when we're in public, especially when we're within 6 feet of others, hand washing, and then making sure that we identify symptoms, we get tested, and then if positive, we quarantine. And those precautions apply really to all communities, whether it's a resource-rich community or a resource constrained community. I think some other ways that resource-limited communities can help in the spread of, help decrease the spread of the coronavirus is to empower the local leaders within communities to embrace science and spread the messages that we're talking about. So, like, you guys have probably heard of, fake news and kind of anti-science and anti-vaccine. There's a lot of misinformation out there, so much misinformation. And you can be the kind of strongest advocates within the circles that you roam, right? So your families, your siblings, your classmates, your friends, you can be some of the strongest voices, regardless of what the politicians, the national leaders, even citywide leaders say. So doing our part to empower the local leaders within these resource-limited communities to spread these messages is going to be key to help with the COVID-19 pandemic.
How has COVID affected minority and low resource communities, and are there resources to help these communities?
Yeah. Unfortunately, the COVID pandemic has highlighted and unearthed the inequities within our health system and our societies. And it has resulted in disproportionate impacts on Black, Hispanic, and colored communities. I'm sure you guys have seen the statistics that have come out since March that COVID has, in majority Black counties, for example, the deaths from COVID have been triple that of other counties. The Navajo Nation has been decimated by COVID, and the Navajo Nation is, in Arizona and New Mexico and in the United States, and they, for the first time in the history of Doctors Without Borders, which is it's a humanitarian medical group that usually goes to war-torn regions to provide healthcare. They actually deployed a group of doctors and nurses to go to the Navajo Nation to help fight the COVID-19 epidemic. So it has had disproportionate impacts on colored communities and communities of limited resources here in the United States. And part of why that has to do with the social determinants of health. So social determinants of health refer to all of the factors in which people are born into, live in, or work in that contribute to their health outcomes. So it's everything from like education to family structure, to the community you live in. And these social determinants of health are the main contributors to to health inequities. And so when COVID pandemic hit, it really highlighted the health inequities that already existed within these communities. And the social determinants of health, in addition to the systemic racism that our country is speaking much more about now, and the kind of the structural inequities, in addition to these communities having higher proportions of chronic diseases, pre-existing chronic diseases, so meaning higher rates of diabetes, obesity, or hypertension, puts these communities at higher risk of having poor health outcomes when they are infected with COVID. So to the other part of your question is, what resources are there for these communities to help counteract that? So once again, going back to the social determinants of health, that is really the crux of it and what needs to be addressed and what needs to change for us to see differences in not just the COVID outcomes, but in any health outcomes. These changes are a lot harder to achieve because they require many times structural changes that are beyond just the healthcare system. So, we talk about jobs and employment for people. We're talking about education, access to clean water, and parks, the environment, an environmental setting in a community that is safe for kids to play in, for example. And so that will require, and it will and does require, the collaboration of people, many stakeholders. So we need politicians, we need activists, we need people in the community. We need many people to come together to make these types of structural changes. And it takes time. It's not something that will happen, over the course of a year or even 2 years. But the work on it needs to start now for any changes to occur. So that's kind of the crux and kind of the long term, the now, but that will take some longer time. And then in the more short term, I would say is access to correct scientific information and promoting that within the community. So we all need to do our part within our own communities, and that starts within our family unit, our friend units, to spread accurate information about COVID, the precautions we need to be taking to fight the spread of it.
Thank you so much for your time. We really enjoyed this interview. I've learned so much.
Thank you so much, Davin and Chloe. And in case you guys are interested more in global health and COVID, I have a great resource that I would recommend for you. It comes out of the Johns Hopkins School of Public Health, and it's called Global Health Now. And every day they send a kind of a newsletter of the top news around health, and a lot of it has focused on COVID recently, but it's fun to read. It's not like overly technical or scientific. They draw information from all sorts of sources, from scientific medical journals all the way to kind of pop culture, to mainstream media as well, and even Twitter and social media. So it's a great synopsis of what's going on in the global health world, and I'd be happy to share the link with you so that you can check it out, and for anyone else who's interested in learning more.
Thank you.
You're very welcome.